Welcome to my child's gastrostomy tube care and tips for the first 6 weeks and beyond. Today you will learn why your child needs a gastrostomy tube, what is a gastrostomy tube, or we like to call it a G-tube, care of the gastrostomy stoma site and the tube care, feeding with the gastrostomy, tube dislodgement, and tube replacement. So why does your child need a gastrostomy tube? If your child is not taking enough water or nutrients by mouth to grow, the G-tube can be used for additional food and fluids. In addition, if your child cannot eat or drink by mouth, the G-tube can be used to provide all the food and fluids your child may need. A gastrostomy tube is an opening from the outside of the skin to the inside of the stomach. A tube can be placed to give your child liquid for hydration, food for nutrition, and medication. It also allows your child to burp or vent. There are many different types of tubes. We have skin level devices. This is a MIC-key button and this is a mini button. You may see either or of these buttons once you have surgery. They are placed in surgery. The balloon is inflated with water. This particular one holds 2.5 milliliters of water. This is what you see on the outside of the stomach. This is on the inside of the stomach. To use, we easily connect the extension set. There is a black line here and a black line here. You line these up together, push it straight down, turn it to the right, and the button is open and ready for use. To disconnect, you line the lines, the black line with the black line, and you're able to easily disconnect it and shut the button. It's easily concealed under clothes. This is a standard gastrostomy tube, which may also be placed in the operating room. At the top of the button, you will see the balloon port, the feeding port, and the medication port. This balloon is adjustable. Unlike the button, it is measured exactly. If you have abdominal distension and you need to have extra length, you're able to adjust it. So when you do not have distension, it's easily fit close to the surface. This is the balloon port, which we inflate with 5 milliliters of water. You see this on the outside. This is on the inside of the stomach. Food and fluid comes through the very end. This tube can also be used if you need to burp the stomach, prevent the stomach more often. This connects directly into here, and you are able to vent the stomach easily. Your child could get a PEG tube, a percutaneous endoscopic gastrostomy. This tube will be in place for at least 2 to 3 months after it is placed either by the surgeon in the operating room, in endoscopy by a pediatric gastroenterologist, or in interventional radiology. Your provider will discuss which tube is best for your child. The first week after the tube is placed, we clean around the site with a Q-tip, water, or normal saline. After the first week, we clean around the site with soap and water as needed. Split gauze may be used around the site, but this is optional. We also would remind you not to touch the BAL on the side of the button, which is the balloon. If you do, the tube will become dislodged, and that will be too soon, right? Because it's 6 weeks when we change the tube for the first time. So we'll have Miss Ellie's mom is going to go ahead and clean the site with a Q-tip and a saline. So we start from the inside out and go around in a circle. all the way around the button. Excellent. You can or you do not have to place a 2x2. You can also use a 2x2 to blot it dry. You do not have to tape it together, however, some parents like to do that. All right. Next, we will secure the tube. Notice that she is lining up the black line with the black line, turning it to the right so that it is locked. She is securing the tube. In case it gets pulled on, it will pull here and not at the stoma site to cause pain. There are many types of tape that you can use to secure the tube. Next, we will connect and disconnect the extension set. She is now turning the tubing around and lining the black line up with the black line and removing the tube quite easily. Now she is shutting it. Now, can you demonstrate how to reconnect the extension set? Open the top flap, line the black line with the black line on the extension set and the button, push down and turn to the right to lock. The feeding extension tubing should be disconnected once the tube can be clamped. Initially, many children get a continuous feeding directly after surgery. We train the stomach to accept larger amounts of food, and then once we can give the food over 30 minutes to an hour, we will disconnect the tubing once it is clamped. Each time you remove the extension set, it must be washed in the sink with tap water first, followed by warm soapy water. Next, we will show how to vent using the tube. First, we will attach the extension set to the button. Next, we will attach the syringe to the top of the extension set. This allows the child to directly burp or vent from the stomach without actually burping from their mouth, although many children can still burp by mouth after the surgery. Many times, you need to vent longer than a few moments. In that case, what we use is a wrist restraint so that we can adjust it up and down. This can be attached to an IV pole or the top of their stroller for ease of use. So there are 3 types of feedings performed using the gastrostomy tube. Gravity feeding is when the formula flows from a feeding bag through an extension tube to an open syringe. Next, we have syringe feeding. You may also pour formula directly into the open syringe in small amounts, usually no more than 1/2 to 1 ounce at a time. Then we have pump feeding. This is the most popular way parents feed their children. A pump controls the flow of formula from the feeding bag through the extension tube, which can be connected to the ferrule bag. It can be plugged directly into the extension set, and this has to be ordered by your physician. First, we will demonstrate how to feed through an open syringe. That's important to remember, that you make sure your medication port is closed So all the feeding has been primed through the end of the tubing to prevent air in her stomach. Next, Mom will attach it to the button, remembering to line the black line up with the black line and turning it to the right. Then the tubing can be unclamped. Once the tubing is connected, you see the milk is flowing in by gravity. Gravity means the higher you hold the syringe, the quicker the milk flows in. Be careful not to let it flow in too quickly. This could cause them to become nauseated and vomit. A typical feeding can take 30 minutes to an hour using this method. It is used sometimes when parents are traveling and on the go. It's an easy way for her to burp from her stomach while the feeding is being administered. Once the gravity feeding is completed, you will need to flush the extension set with water, typically 5 to 10 milliliters. Your nurse or doctor will let you know how much to flush the tubing with. Next, she is connecting the water to the end of the extension set and is going to unclamp it. Once you have flushed, you will clamp off the extension set and remove the big syringe. So, in addition to syringe feeding, you may also feed by gravity using the syringe method. In addition, you can use the feeding bag to provide gravity feedings, which we will demonstrate now. The feeding bag is connected and held upright or on a pole, elevated at least 6 inches above their belly. The tube is unclamped and it flows in. The higher you hold the bag, the quicker it flows. The lower, the slower. Now we will disconnect. And once again, we usually flush after each feeding with at least 5 milliliters of water, or the amount that is prescribed by your physician. Next, we will demonstrate feeding with the feeding bag on a pump. Your doctor will prescribe the rate your feeding should be administered. Many parents have a mini backpack which holds the feeding pump, the feeding bag, in addition to the Ferrell bag, which is also a method of decompressing the stomach or burping. If your child is able to eat by mouth, they would eat by mouth first and give the remainder by the gastrostomy tube. She's cutting the pump on to prime the tubing. Notice that this is clamped so that food will not go up the bag right now. The tube has already been flushed and is ready for use. It's been attached. The clamp is undone here and the clamp is undone on the feeding line. Notice that the Ferrell tubing is attached directly into the extension set and the feeding is placed in the feeding port of the Ferrell bag tubing. The feeding can be administered and gas bubbles or air as well as extra food can come up the Ferrell line directly into the Ferrell bag. Air from the stomach will directly leave the Ferrell bag through the vent at the top of the bag. Take care not to get this wet or it will not work. The Ferrell bag must be changed daily along with the feeding bag. Occasionally there may be a little air bubble in the line. You can set the pump to run over an hour or half an hour, as well as a continuous feeding, which many children get overnight, which can run for as long as 8 hours. Every 4 hours, additional formula must be added to the bag. Now we will discontinue the continuous feeding. The tubing is clamped off so that when she discontinues it, there will not be a backflow of formula. In addition, the tube will be flushed with water. Remember, your provider will let you know how much to flush the tubing with. Now that we have completed our feeding, we will disconnect the feeding set from the button. Next, we will talk about tube dislodgement. The tube is typically securely taped to prevent the tube from becoming dislodged. The balloon in the stomach holds between 2.5 to 5 milliliters of water. Your provider will let you know how much water is in your balloon. Typically, it takes 6 weeks for the opening from the outside of the skin to the inside of the stomach to heal. It typically goes through the top layer of the skin, the fat pad, the abdominal wall, and then the stomach. During this time of healing, if the tube becomes dislodged, it is very important that we follow these steps. Usually, this does not happen, but in the event the balloon does become dislodged or there is a leak in the balloon, the tube may actually fall out quite easily. During the first 2 weeks, the parents have been instructed not to replace this themselves. They are to place a dressing over the site, tape it down, and bring them to their closest emergency room with their backup button kit for replacement. Typically, if this is replaced in the emergency room before 6 weeks has passed and the site has healed, they will need to get a special X-ray to show that the tube is actually in the stomach and there are no leaks outside. If this happens, they will replace the button in the emergency room, and they will attach an extension set to the button. Would you like to hold it all? Lining the black line with the black line, turning it around, and what they would do is take a special X-ray, putting dye down through the tubing to look for leaks outside. Once the stomach placement has been verified, it is safe to feed your child either by mouth or by tube. But until the X-ray is performed, you should not feed your child until told to do so by the provider. At 6 weeks, the stoma site is healed. After that time, we will be able to change it in the office without having to get a special X-ray, and the parents are taught how to do this. At 6 weeks, we see them back in the office, or a few weeks later, to change the tube for the first time. It is usually a good idea not to feed them for an hour prior to the appointment so that their stomach will be empty. Next, we have our new button kit. We open the button kit, and inside there is a button. This particular button uses a stiffener. You put that down through the center of it. You do not always have to use this to put it in, it just makes it easier. You can also see the size of the button. This particular one says it's a 12 French, which is a diameter around how big the opening is in the skin, and 1.5 centimeters, which is 1.5 centimeters from the outside of the skin to the inside of the stomach. This particular balloon holds 2.5 milliliters of water. We practice with air, although we use water. This is what is on the inside of the stomach. This is on the outside. The food and fluid come through the bottom of the button. Okay. The kit is sterile, although the procedure is clean. We also have our extension set, and we have our lubricant. No Vaseline should be used on the tubing. Our Surgilube is water-soluble lubricant. Next, Mom will go ahead and take the dressing off the site. Then we will use an empty syringe with a luer slip tip to remove the water. Now Mom will put lubricant around the stoma site. There we go. Okay. This helps the tube slide out easy. Mom is going to remove the tube easily. Okay.
You did it.
Okay. All right.
I know. I know.
Here you go. Next, Mom will quickly replace the button Now Mom will place the water in the balloon, or 2.5 milliliters. Now Mom will take out the blue stiffener from the center of the button, and now we will attach the extension set to check for stomach placement. We check for gastric contents. You can use the small syringe to pull back. We see gastric contents, verifying we are exactly in the stomach where we need to be. We could also use the large syringe and attach that to the bigger end of the Y port on the end of the extension set and withdraw as well. We can also remove the extension set and check with the empty syringe directly into the center of the button. Hold onto the button and wiggle it in, and then pull back, and we see gastric contents this way. This is also a way you may give medications in the middle of the button without using the extension set. If you do so, make sure that you flush after each medication. Do not mix medications with food. You do not need to place a 2x2 dressing around the tube. There are other tips that are important. It is important to pick clothing that will cover the button so that they may not have the ability to pull the tubing out. It can easily get caught on toys. If you secure the button, it will also prevent granulation tissue from forming. Typically, they need to take a sponge bath the first week or so after surgery while the incision sites are healing. Then they are able to easily take a bath. You can wash around the site with soap and water in the bathtub. Remember to remove any dressings before you do wash around the site. Don't forget mouth care. You will need to care for your child's mouth even if they are not eating by mouth. This helps to prevent a dry mouth, cavities, and gum problems. Your child can resume normal activities such as crawling, walking, running, therapies almost immediately after surgery. Sometimes there is extra tissue called granulation tissue that forms around the gastrostomy site. It has red blood cells called capillaries in the tissue, and it looks like the inside of your mouth. It is normal for this tissue to form there and usually subsides over time. Granulation tissue is important for healing. You will see it in wounds or cuts. It helps it heal from the inside out, except you have a button sitting in an opening in the stomach so that your body cannot heal the opening over, so the tissue forms around that for a short time. Sometimes it may drain white, yellow, or green fluid. However, the site rarely does get infected. If you see this red tissue and it does drain or bleed, call our office and we will be happy to see you and apply special medication or dressings to the site. Now you have learned reasons why your child needs a G-tube, what the tube is, and how to care for the site and provide tube care. We've also shown you how to feed with the gastrostomy and how to perform tube replacement. If you have further questions, we are here to answer them for you and we'll be happy to help you at any time. And a special thank you to Ellie and her mom for showing us how to care for your gastrostomy tube.